A couple of months ago, I talked about what data analysis we were doing in our local primary based commissioning cluster. We wanted to look at how outpatient appointments were being dealt with by the hospital and how we were referring to them. A couple of months down the line, we've now actually got some results for this. One of the things we were looking at was how many new appointments went to patients who had only fairly recently been seen by the same speciality. Now, this varied between specialities quite a bit, and this is not going to be a terribly clear graph on here, but certainly we've had a couple of specialities, particularly in general medicine, that have stood out as having patients that are frequently back and forward. And we're having to look at the reasons for that a little bit as well. The other thing we were able to look at there, if I can close this window, is how referrals varied by the number of patients on a practice's CHD register. Hopefully this was going to be a more sensitive way of correcting the number of referrals than looking at raw population. And if I bring the camera a bit closer, I'll be able to show you this. We can see here that most practices have about the same number. There are outliers, and we already know these are fairly unusual practices, but we can get an idea of how things are going to move. These are relatively small numbers, so we expect a little bit of variation. One of the other things we see is how we can measure a total morbidity and try to judge referrals against that. There's quite a good line there. This is a homemade morbidity measure, but one that has a reasonable amount of statistical significance. One of the other things we saw was that there was quite a bit of overlap between specialities. Almost 20% of the patients referred to geriatrics also have a referral to cardiology. And we're hoping to improve service redesign by looking at those. And I'm currently working through a list in the practice. And that's about it for this month, but interestingly, this is probably the last data analysis I'm going to do like this. Eagle eyes will have spotted that this is not actually my work, this is my kitchen, this is my own laptop, and that was an NHS copy of Microsoft Access on the home user scheme. I normally use the server database when doing the QoF data, and this is probably going to be the last time I get to use Access like this. So it's going to be interesting to see some alternate programs for dealing with the data next time.